Hi, welcome to Bernalillo County's Town Hall on Behavioral Health for District 3. My name is Jim Colley. I'm the Commissioner from District 3, and let me introduce some of the people on the screen to you. Adrienne Barboa is the Commissioner-elect for District 3. We're delighted she's here and can participate in this District 3 event. And Margarita Chavez Sanchez is here. Margarita is the Director of Behavioral Health Services for Bernalillo County. And we're delighted that during this very difficult time in which we all need to be keeping our masks handy and using them on any occasion we're with people, it's a great time to talk about behavioral health and how indeed the county is working to influence those. You see a few other folks on the screen as well. Evan Gonzalez is the media guru out of behavioral health. Brandon McEachern, who is also here, is part of the District 3 team. So welcome to this. My dogs are barking in the background. My apologies for that. And in the real background, come here. In the real background, you can see the new Bernalillo County Fire Department Engine 38, which is a brilliant piece of work. It's newly arrived on scene, and it's at Station 38 in the South Valley. It's a great piece of equipment. It can pump amazing amounts of water and help us with all kinds of fires. So I wanted you to see that background shot of the new piece as well. I want to say again, thank you for coming today. District 3 had a tradition of having monthly luncheons, and we've missed that since March of this year. And we thought this would be a great opportunity to invite our luncheon bunch and anybody else who wants to come in to this presentation. Adrienne, do you want to take just a minute and kind of introduce yourself to District 3 people and say hi?
Yes, thank you so much for this opportunity. I am Adrienne Barboa and proud to start officially serving as your County Commissioner for District 3 starting January 1st. I have been much obliged to have the support of Margarita Chavez, Commissioner Colley, and others at the county to already start getting me some information about the county. And I'm excited to join the behavioral health issues and the way the county is working to address the needs of our behavioral health needs across the county are super important to me. So I look forward to hearing all the information today and engaging with folks in the future. So thank you again, and thanks for the opportunity to be here and speak to folks in the district.
Thank you, Commissioner-elect. Margarita, why don't you introduce yourself and take a run at this?
Sure. Thank you, Commissioner. Thank you, Commissioner-elect. As the Commissioner mentioned, my name is Margarita Chavez Sanchez. I am the Director of the Bernalillo County Department of Behavioral Health Services. It's a mouthful there. But we have been working for many years on addressing and mitigating gaps in the behavioral health continuum. And so today is an opportunity for us to share this information, provide updates, because the biggest misconception that we hear in the community is we're sitting on a pile of money and we're not doing anything with it. So the Commissioner and Commissioner-elect are giving us an opportunity to have a virtual town hall. We wish it could be an in-person town hall, and hopefully in the relatively near future, we can have an in-person town hall to have greater dialogue with folks. But for now, we felt it was important that we get this venue, use this venue to get this information out to you in a way that maybe is more meaningful than just receiving a newsletter. So excited about this conversation, and Commissioner and Commissioner-elect, if you're good with it, I can just kind of jump right in. All right, so I'm going to share my screen. I'll provide some information in this PowerPoint, but a big piece that's really important to mention is that if you have questions, if you have any questions, let me try to make sure I can advance. You can see this, right? We've introduced ourselves. I'll skip through this slide. But if you have any questions, there are venues to ask those questions live. So since this is a closed stream, so to speak. You can't unmute yourself or log on to ask questions. So we created these venues. So you can comment on our Facebook, email behavioralhealth@bernco.gov, or you can use the link bernco.gov/town hall. Feel free to email myself, email Evan, or email Brandon, or this behavioral health link and or Facebook, and we will answer those questions in real time. Some questions were sent prior to this presentation, and so we have embedded answers of those questions into the presentation. But absolutely, if there's ever a time that you feel that those questions that were submitted early were not answered to your liking, feel free to submit more clarifying questions. So start with a little bit of historical information. So many of you are aware because you worked hard on this, but back in 2014, the County Commission took a ballot question or a question to the voters to say, would you be willing to tax yourself to address services, the need for behavioral health services for youth and adults that are not otherwise funded in Bernalillo County? With an overwhelming amount of support, that question passed and a tax was implemented. That tax began to be collected in 2015, and in the initial years collected about $17.5 million. As we have progressed through the time of collection of this tax, slowly every year that amount has increased. The most recent fiscal year generated about 20 million, just over 20 million, with 21 million. Unfortunately, with COVID, we're predicting that there's going to be a significant impact on that gross receipts revenue. So it's important that I mention that. We've been really thoughtful about the utilization of these dollars to not spend above what we thought we were going to generate in the coming fiscal year, so that we wouldn't have to cut programs. So fortunately, although we're seeing a decrease in revenue in the gross receipts this year, we know that we will not have to cut any programs. We have a few programs that are paused for the time being, but we're not going to be cutting any programs. So those programs that were paused were programs that had been passed but not launched yet. So again, none of the existing service deliveries that we'll discuss today are being cut in any way at the moment related to the decrease in the gross receipts revenue. So again, I think it's really important to recognize that the top priority of the Department of Behavioral Health Services in launching the Behavioral Health Initiative was to ensure that we had true and meaningful community input. Those of you who are watching today are here because you care about community input, right? You really do care about the voice of the community being heard by your elected officials and by the rest of the county as it pertains to behavioral health and roads and public safety and access to services, community-based services, homelessness, right? And so in building this system, we developed 4 focused areas that were a venue for which we could implement meaningful community input. Those focus areas are crisis services, community supports, supportive housing, prevention, intervention, and harm reduction. Each of these committees is staffed by a behavioral health staff from our department, but it is comprised of those with lived experience, family members of those with lived experience. And I tell you, our family members are our biggest advocates because they know what it's like to help their loved one try to navigate the system. We have subject matter experts and technical advisors on each of those committees. So again, it's really important to recognize that we're needing this meaningful community input in this way, as opposed to just saying, come to the county commission and make public comment. Right? We take any project proposal or any concept that we're looking at vetting to these subcommittees and we say, tell us what you think about this. Give us the input from the ground up. How can we make this better? Or is this idea in left field and should we scrap it and focus on something else? And so these committees initially in the first few years met monthly, oftentimes more often than monthly because there were a significant amount of dollars to be spent and a significant amount of gaps in the community. Since we have appropriated a majority of the recurring dollars, these committees meet on a quarterly basis. Even through COVID, all of these meetings have maintained that quarterly regimen. It's all via Teams now, so none of these meetings are happening in person. but we are continuing to have those meetings. We actually, in the last quarter, have added new committee members, and every year we solicit new members to participate in these committees. Now, this flow speaks to a vetting process. So as I mentioned, a project goes to one of these committees, and once this committee puts their stamp of approval on it and provides all the the input and feedback we want, it moves on to the steering committee. Now, the intent behind the steering committee was to ensure that we didn't silo these 4 areas, right? Prevention wasn't working on something over here, and crisis services wasn't working on something over here, and they didn't talk to each other. And we wanted to make sure that the age-old problem in the state and even in the nation is that many of these service delivery areas work separate from each other, right? Those who work on crisis services don't always work with the housing network, right? And how do we patch that? Because we know many of our community members in need have needs across each of those 4 areas. So the steering committee is built of the chair and vice chair of each of the 4 focused committees. And so again, the intent is to bring those venues forward to say, in prevention, we're working on this. And then the chair from crisis can say, hey, that really relates to what we're talking about. Let's bring those conversations together. So that, again, there's another vetting space in that steering committee, and then it moves to our elected officials. So our elected officials on the Albuquerque-Bernalillo County Governing Commission, or our ABCGC, have an opportunity to discuss these concepts. And it's irrelevant whether it is a city project or a county project, it comes to the table at that ABCGC. From the ABCGC, it then goes on to the respective funding bodies. So if it is a utilization of the county behavioral health gross receipts tax, the county commission has the final approval of the allocation of funds. If it is something from the city council or the mayor's budget, it goes respectively to those governing bodies for official appropriation and allocation of funds. So this and the next slide are extremely busy, but I included them on purpose because I want you all to see the gravity and the length of work that's been done over the last 4 or 5 years. All of these projects that are listed, or all these programs that are listed, are currently funded or funding has been appropriated. So we have services along that crisis continuum, prevention continuum, community supports continuum, and housing continuum. Now, something that's really important to mention is that, as you can imagine, there are administrative costs that go with the launching of these projects. The Department of Behavioral Health Services and the work on the Behavioral Health Initiative was essentially done by me and the former director, Katrina Hotram, who's now our cabinet secretary. And it was a lift for just the 2 of us. So we were able to build a department and added, I believe at that time it was 19 additional staff to be able to stand these things up and get things moving. So that's part of your administrative payroll and operations. Our behavioral health advisor, we contract with Pam Hyde and Associates. She has been on board from the beginning. Pam Hyde is actually the former federal secretary of SAMHSA, and she's a New Mexican. So we have this phenomenal resource here in Bernalillo County to us. While the role of the behavioral health advisor has decreased as we've launched programs, right? There was a lot of advice needed on the front end. We still do meet with her regularly, meet with her team, and plug them in as needed. So I want to change gears slightly. We talked a little bit about the structure for the Behavioral Health Initiative, but we often get a lot of questions about what we do on the CARE campus, especially since this is your district, right? The services on the CARE campus, formerly known as MAPS, provides a wide array and a continuum of supports for people needing behavioral health services. And I really emphasize the word behavioral health services because it hasn't always been that way. The services on the CARE campus, or MAPS, were originally intended to address primarily and almost exclusively substance use-based services. And as we've grown, as the Department of Behavioral Health Services has grown, we recognize that that need is greater, right? It's not just address the substance use disorder, but it's also address the underlying behavioral health need. And sometimes it's kind of that chicken or the egg, right? Was the behavioral health need there first that led to the substance-based need, or was a substance-based need that led to the behavioral need or the mental health need? And so every time we say behavioral health, we're saying this is inclusive of behaviors like substance use and mental health needs. And so again, it is that full continuum. So now we are the CARE campus. We are the Comprehensive Assessment and Resilience in Excellence campus, right? So it's a mouthful, so we call it the CARE campus. So on the campus, we provide a number of direct care services. Our public inebriate intervention program, this is an overnight sobering service. It's on the lowest level of the harm reduction continuum. People can come to us who are intoxicated and ambulatory. We hydrate them, we feed them, we observe them overnight, and then connect them to services in the morning. So this is for folks who are not ready to pursue detox or treatment, but are looking for a safe space to stay. Many of our clients self-report, but we do have a number of clients who are brought to us by law enforcement and first responders. The intent in this project was to provide a safe place. It is absolutely not intended to be just sheltering services, but a safe place for people who are publicly intoxicated, and they can be observed to make sure that they stay healthy overnight. Again, also a venue for which our law enforcement entities and our first responders are not taking clients who don't need it to the emergency room or to the jail, right? It's an alternative venue for which we can provide more appropriate care for these clients. Our social model detox program, that social model detox program is a 10-day program for folks who are needing detox from substances. It can be alcohol, methamphetamine, opiates, and any combination, right? We have no substance now that is refused. We are partnered with the University of New Mexico, who runs our MOTU clinic. It's our medical observation and treatment unit on site. They provide medical services, including Suboxone, Suboxone induction, and Suboxone for detox for clients who are needing it. Our supportive aftercare program is the third level of our continuation of harm reduction for substance-based services. That supportive aftercare are apartments in the back of our building for residential treatment, or sober living is the best way to describe it. So our clients live on campus with us free of charge, and they get behavioral health support so that they can be successful after that time that they leave us. This program is up to 30 weeks or 6 months. And so it's not uncommon for someone to come into PIP. After a few nights in PIP, they are encouraged to go into detox. They go into detox, they stay with us for 10 days into detox, and then what they want to continue their journey in sobriety, and they go to the supportive aftercare program. So the goal is for us to have that full continuum of services available for the clients and meet their needs when they're ready. Now, part of the supportive aftercare program is another collaboration with the University of New Mexico. This is our Milagro program. Our Milagro program is provided for women who are pregnant or postpartum who also have an addiction. University of New Mexico provides the physical health care for mom and baby, and we provide the social model, substance-based care, and the residential treatment on campus. Now, our newest program that has been live since December is our crisis stabilization unit. We have a crisis triage license, and that's really exciting. We are the second in the state to receive a Department of Health crisis triage license. So it's big news for the county and big news for District 3. And again, it's really exciting to be able to provide these services to our residents in county. And this crisis stabilization is for folks who maybe have no underlying substance-based need, but are needing behavioral health stabilization. Maybe a family member took their loved one to the psych emergency, and psych emergency felt that they were not acute enough to be admitted, but maybe not quite healthy enough or safe enough to just go home and manage it on their own. They can come to us for up to 14 days. And this is the start of a larger vision in providing crisis stabilization and crisis triage. Related, we have executed a $20 million MOU for a crisis triage center and adult psychiatric services with the University of New Mexico Hospital. And actually just at the last county commission meeting, officially announced the location of that new crisis triage center. It'll be immediately adjacent to the existing psychiatric emergency room on the UNM footprint. And so again, that will be part of that larger continuum. So now I'm going to jump into a number of the projects that you saw on those very busy initial slides that are currently funded. And a mobile crisis is often a place that we start because We hear a lot about folks who are have behavioral health needs, who are in front of businesses or are on the street corners or in neighborhoods needing supports. And mobile crisis teams is a venue for which there is a more appropriate 911 response for people living with a behavioral health need. And I pause for a second to just think about the very first slide, right? We talked about the passage of the gross receipts tax. And when we passed that gross receipts tax, there were a number of incidents that happened in the community, right? Our former governor, Susana Martinez, dismantled an existing behavioral health system, and it caused a number of our behavioral health providers to exit the state. And we had some very negative interactions between law enforcement and our behavioral health community. And many of those interactions happened on a national scale, right? They were captured on cell phone video, and it was on Good Morning America and other places. And so it really prompted the community to say, we need to do something different. And Mobile Crisis was one of our programs that launched initially in response to that outcry in the community. So Mobile Crisis teams pair a master's level behavioral health clinician with a first responder. Initially, it was with a law enforcement officer. We have APD, there's an error there, not APS, it should be APD, for APD and 2 BCSO teams. And we have now are finalizing the launching of 2 non-law enforcement teams with the Bernalillo County Fire Department. Those teams will pair with a firefighter to respond to less acute calls that don't require a law enforcement component, right? There's no need for it to send an officer, but people are still needing this crisis type of response. We're really excited about that change. Another piece that's really important to mention is our transition planning resource reentry program. A number of times, community members came to the commission meetings and said, people are being released from jail in the middle of the night and they're being dropped on the corner of 4th and Roma. How is this safe? How is this helping people be successful? And so we knew again that we had to do something different. And so we basically took over the first floor of the Public Safety Center, also on the corner of 4th and Roma. We renovated that space and we launched our Transition Planning Resource Reentry Program. Now, this program is more than just a building at the Public Safety Center on 4th and Roma, but it's the service that we provide starts in the jail. So every time someone is booked into the jail, they get a receiving screening. That receiving screening looks for risk to recidivism. It looks for criminogenic risk. It looks for behavioral health needs and substance-based needs. It looks at suicidality. It looks at social needs. And so it automatically generates a score based on answers as to the level of risk. So it triages folks in high to moderate to low risk. Anyone who's triaged in high to moderate risk, we deploy our transition planning team. Now, things are a little bit different right now with COVID because these teams are not allowed to physically be in the jail, but they are doing video visits right now. Outside of COVID space, those transition planning teams are housed in the jail and they immediately go to the pods and begin working with these individuals who are high to moderate risk to develop a transition plan to help them be successful in the community. Again, we want folks to be able to identify housing. Maybe housing is the issue, is that folks are coming out of jail and they don't have a place to stay, so they end up, sleeping on the front steps of a business, and then that business calls 911, and then maybe there's a charge that comes with that interaction, and then they recidivate back into the jail. So how do we mitigate that? And so these transition planners work with them in the jail to begin that plan. Now, a piece that we know about the Metropolitan Detention Center is that a majority, on the upside of 70% of their inmates that are booked, are in and out in 72 hours. And so sometimes that's not enough time for the transition planners to be able to meet with them. So hence our Resource Reentry Center. That Resource Reentry Center is open 24/7, 365, staffed by case managers who can immediately help address those needs. So if someone needs that support, whether they've scored a high or a low, if they engage with someone at that RRC, those case managers can connect them with the services. Now, we also have resources there like access to internet. The computers that you see on this picture here, oftentimes people who get out of jail if they don't have a phone, or maybe their phone is dead. We also have a phone charging station. I have to say that's the most highly sought out resources, because if I don't have a charged phone, how am I going to call someone to pick me up? How do I get connected to my service, my supports? But it's not uncommon for people to log onto the computers and get on Facebook, so that they can use Facebook Messenger to communicate with family to say, hey, I need a ride, or how do I get connected to this? We also have bus passes that we can connect folks with if they need it, and even an opportunity for motel vouchers if it's appropriate for that client. We have sandwiches and coffee, and again, we want this to be something, if you can get that feel from this picture here, that wasn't like an institutional type setting, right? We wanted like normal chairs, normal computers, paint on the walls, so that folks knew that this was a soft landing spot for folks to come back into the community from being incarcerated, and a place for which they can find support. So our Adverse Childhood Experiences project is actually our very first project that went out into the community. This is a $3 million annual investment, and we work with a number of providers who work with clients who are 0 to 18. So women who are pregnant, all the way to 18-year-olds. And that service delivery adjusts based on that continuum. So Peanut Butter and Jelly Family Services works in kind of the early childhood space and works with families and preschool age children to address adverse childhood experiences. And for example, the Adobe Project works with youth who are engaged in the criminal justice system and are coming out of the Youth Services Center. And so this project actually was launched immediately after the crisis with Victoria Martin. We knew we needed to do a better job about providing resources for youth who were in traumatic events in their life, who in their early stages of life had traumatic experiences. And so we're funding a number of different providers who provide these services here. And just as a note, the way that I do presentations is to kind of speak to the concepts and not read the slides. So this information is available to you to kind of read through the slides, but I will provide the general overview. Every presentation I go to where someone reads the slides, I feel like it's death by PowerPoint. So I try to do it a little bit different for you all, but we'll make sure that you all have a copy of these slides after we're done with this presentation as well, if you'd like that. So our training and education project was funded by one-time dollars. It's $3 million, $1 million per year over 3 years. And this was really important to us as well, because we felt like we needed to do a better job of training the community to reduce stigma, to create awareness around the services that we have or around services that are available. For example, the Bernalillo County Community Health Council is doing trainings on MAT and opiate use disorders, so the community can learn more about opiate use disorders and not feed into preconceived stigmas or preconceived notions. And like NAMI, the National Alliance on Mental Illness, is working on family-family to peer and peer-to-peer type trainings. So again, it's our intention to really get this training out to the community. 2 pieces of training and education were vital to the subcommittee. They felt that we needed to provide training to the community at large, right? Providing information for the community at large on the topic of behavioral health, but also training for professionals who work with those with behavioral health needs, right? That's more around that motivational interviewing and empathetic listening and vicarious trauma. And we encourage bus drivers, right? We encourage first responders. We encourage case managers. We encourage nurses and teachers and anyone along that continuum who could possibly engage with someone who had a behavioral health need to go through these trainings as well. These trainings are all free of charge to the community and to providers in the community. As a side note, you can always go to our website, it's bernco.gov/DBHS to access any of these trainings. Suicide prevention has also been very critical to us. We see regularly on the news that New Mexico is at the top of the charts when it comes to suicide. And unfortunately, COVID has not helped that, right? It's actually gotten worse because folks are being forced to isolate in their homes and maybe isolate further into a depression or concerns. And so we've invested in suicide prevention. We have 3 providers, including APS. So Albuquerque Public Schools is one of our providers because we felt like we need to do something about youth who are having thoughts of suicide or who have completed suicide, and working with other students who are on that, who have that need, and really making sure that we do a better job about connecting them to services. We absolutely believe in the concept of the peer. Here in New Mexico, and actually nationwide, we have a huge provider shortage along that behavioral health continuum. And we believe that the peers are the glue that helps us keep it all together. So we have funded peer support drop-in centers and peer case management to continue to expand that connectivity for clients to services. So peer case management is working with Centro Savila, and it's also not listed on there. Crossroads for Women is another one of our providers for peer case management. And peer support drop-in centers is Albuquerque Center for Hope and Recovery, and New Day. New Day really focuses on youth, particularly kind of those transition age youth, which we know is a very vulnerable population who often has difficulty accessing traditional services because they're on that fringe. Do I access adult services that don't really meet my needs, or do I access youth services that don't really meet my needs? So really focusing on that transition age has been phenomenal with New Day. Law enforcement assisted diversion. This is another project funded through the BHI. This project allows for law enforcement to refer folks who have potentially committed a crime, or maybe they've engaged with, and they have a level of need, to us at the care campus for support in lieu of being booked on this charge, right? So some of these charges include low-level drug offenses, low-level crimes, and again, it's really important to recognize that the officer can bring them to us, but the DA ultimately decides whether or not that charge can be dropped. Nonetheless, the intent of the law enforcement assisted diversion program is to divert people away from the criminal justice system and plug them into help. Youth transitional living services, I just spoke to the need amongst this population. So it's really important, again, that we are funding youth transitional living services. We're funding Casa Q, who focuses on LGBTQ youth needing support, YDI, A New Day, and Serenity Mesa. We know that along that housing continuum, it's not as simple as just putting a roof over someone's head, but it's providing those supports for folks to be successful. So we are funding those supports, again, to help our youth be successful and move them out of that higher level of service. Community connection supportive housing. So we're shifting into the housing space. And I will say, in full transparency and 100% accuracy in my mind, the biggest gap in the community is housing, right? Every provider we talk to, every group that we talk to say, I need to find housing, I need to find housing, I need to find housing. And so we have invested in a number of different supportive housing initiatives. Our Community Connections Supportive Housing Project has been in place for some time. This again was one of our first projects. And this project is a collaboration between the city of Albuquerque and Bernalillo County. The county provides $2.7 million a year, and the city of Albuquerque provides $500,000 a year. This is scattered site supportive housing. And so this works with an intermediate level of need client, pairs them with a case manager for whom they meet with on a regular basis, and provides a housing voucher for them. So these clients have to have had engagement in the criminal justice in the past, or been high or frequent utilizers of services like the emergency room or services on our care campus. So they have an acute need because they've been hitting these high systems on a regular basis. We want to pull them out of that space, plug them into housing, and get them the supports that they need. Now, I mentioned that the Community Connections Project is scattered site. We have invested in 2 single sites. The single sites that we have invested on, the first one is our multifamily housing unit. This is specifically a county project. It'll be providing supports for those who have a behavioral health need similar to community connections, but the acuity of those clients is much higher. That whole first floor of this building is going to be dedicated to on-site services and supports. We will have a peer case manager on site 24/7. So if someone starts to spiral or has a need, they just have to walk downstairs, right? We will also have offices for providers to provide supports like case management, social support, group, individual counseling, group counseling. And again, the intent is that the clients have such an acute need that navigating getting from a scattered site to an appointment has been difficult for them. So we want to provide those services on site, right? Hence the single site. So those services will be available on that first floor, and then the apartments will be on the floors above. The second single site is a collaboration with the city of Albuquerque, and this is actually, again, a collaboration in funding, and the provider is going to be funded by the county. So we have a $1 million recurring annual operations budget that is going to be provided to our provider. That provider has been selected. It's St. Martin's Hope Works, who will be providing a single site. And this is going to be specifically for adults, single adults, whereas the previous site is more of a multifamily unit who can serve families. A piece that's really important for everyone to know is that we work intimately with the University of New Mexico Institute for Social Work Research. We absolutely believe, and it has been communicated at length by the committees, that it is not our intention to just fund all of these projects that I just mentioned into eternity because they sound great, right? We want the data to inform the continued funding of these projects. So the Institute for Social Research is embedded in these projects from the moment of execution of contract all the way through the completion of the contract. They are helping us develop performance measures, and they help us look at performance evaluations and are conducting process evaluations and outcomes evaluations for all of these projects. Again, the data will drive where things move. So, for example, we had a shift in the mobile crisis team project early on. And part of that shift was because UNM ISR told us, hey, something's not jiving here, we're not getting good data. And it gave us an opportunity to just say, okay, let's shift the hours a little bit in order to match the data that we received. And like, boom, all of a sudden the call volume went up. And so we don't want to wait 4 years when an evaluation is done to make those changes and feel like we've lost that time. We want to make changes in real time and catch those changes early so that we can make these programs successful, right? We don't just want to say, oh, nope, we just did an outcomes evaluation. That program was terrible. We're not going to renew it, right? We want to catch those changes along the continuum so that our providers can be successful and we can get these out to the community. There was a question about our $10 million capital and startup RFP that went out last year. Happy to announce that we have one contract left to finish negotiating. As soon as that is executed, we will be doing a formal announcement. It is our intention to do a formal announcement of our providers on the December Bernalillo County Commission meeting. So we're really excited to announce our providers and to get that money back out into the community. So I talked a little bit about COVID early on, and there has been an impact on the GRT. Fortunately, we were able to pause a couple of different projects, and this last slide is something that's really important for you all to know. Both of the single sites that I mentioned are currently being built. Since they are currently being built, the reoccurring operational funds are not going to be needed, right? There's nothing to operate yet. They're under construction. So each of those line items will be paused and held because we're predicting that we won't receive that amount of revenue this year. We also had an available fund balance of just over $700,000 that could have funded new projects. Again, since we're not going to be receiving those dollars, no new projects will start as a function of that fund balance. and our school-based health centers and peer support for aging population that were passed. And I believe April are paused. The hope is that we're going to be able to launch those soon. But again, we're pausing on a couple of these projects. In response to COVID, we've done a couple of things. The county issued a grant out into behavioral health providers, similar to what I'm sure you've all heard about the economic development grants. For any behavioral health provider who has seen an impact on their services, right? Maybe they needed some funds for new telehealth equipment. Maybe they needed funds for masks and plexiglass partitions. Or maybe they needed to they had to convert all of their practices to telehealth, and they had to upgrade their Wi-Fi system, right? So these grants were to provide support to behavioral health providers. It was one-time grants of up to $10,000 each, and we funded just under $500,000. I think it was $480,000 out to the community providers. So it was a way for us to help the behavioral health providers in the community get some support during this time. We also are currently operating a motel voucher program and working with the APS McKinney-Vento program to house families who were newly unhoused or precariously housed as a result of COVID. Maybe they lost their job, they got laid off, maybe they were traditionally staying with tia or tío, and they can no longer because there's too many people in that house. And so this provides transitional living or motel vouchers for those families, and the APS social workers work with them immediately to identify employment or permanent housing supports. So really exciting, we have published an annual report and strategic plan, and just wanted to put this out there because it's important for us to know that that is available. There's been lots of questions over the years asking about, where are we going? Why are we going that way? Why have we done what we've done? And what are we measuring? And so this strategic plan provides all of that information in a document. The document's pretty large, but I think it's very worthwhile information. The commissioner I see him shaking his head because he loved it. And it really does provide good information. And so I want to make sure that you all know that that's on our website. We also did publish an annual report in the last month, which also has great information, has more details from what I listed here and what I communicated as a part of this presentation. But again, it really is an opportunity for you to see more of the details of what we've done. And everything that we've done is getting recognized on a national stage. And so this past year, we received 5 awards from the National Association of County, 5 achievement awards, including one which was best in category for our supportive aftercare program and collaboration with Parks and Recreation. And so we just have this slide to say, what we're doing here in little old Bernalillo County is being modeled across the country, almost on a weekly basis, if not daily basis. We are contacted by a jurisdiction somewhere in the country. We actually had communication from Canada and Mexico. So internationally, asking us questions about what we're doing and how we can help them implement those strategies nationwide and internationally. So it really is important for us to know what we're doing. It's making an impact here locally, but also on a federal and national level, we're doing everything we can to help other jurisdictions do that. A question that had come in that I forgot to mention is, all of the behavioral health projects that I mentioned, and we're on those very busy slides, those are all new programs. The gross receipts tax is not funding a single program that was in existence prior to the passage of the tax and the launch of the Behavioral Health Initiative. So the services on the CARE campus, with the exception of crisis stabilization, as I mentioned, that's really new in the last year. All of those programs are funded from other funding sources. The Behavioral Health Initiative programs, or the behavioral health programs, are all new programs from the tax. We are absolutely not supplanting a county budget or the department budget with this gross receipts tax. So I'll just stop there. I think we have a good 15 minutes for questions. And I just want to say, as I mentioned, bernco.gov/DBHS has all of this information, again, including our annual report and strategic plan. And any other reports. There's a number of reports there that the University of New Mexico Institute for Social Research has published about projects. Those are listed there as well. And follow us on our social medias. again, that's an opportunity to get more information and be engaged. All right, there's my information as well.
Margarita, that was overwhelming. You know, it's the classic stand below a fire hose and try to get a sip of water. It's hard even to know where to grab hold of that one. We have had several questions come in, and we've sent that along to Commissioner-elect Barboa. But I have this question first, and I'm not sure there's a good answer to it. I'm not even sure it's a good question. As you just said, all of these programs are new programs. And one of the things that I'm really aware of is that it takes a long time for a community system to catch up with where the new programs are and how they're available. As a citizen of Bernalillo County, I wouldn't even know who to go to ask for help. You know, what can we say to people in District 3 about this huge array of programming and how we would find out what's appropriate for a family member or for myself or for someone who, you know, in a conversation says, I need help and I don't know where to go?
Yep. Yeah, I think that's a great question. And it's a very common question that we receive. And I think, you know, there's a couple of answers. Number one, in a moment of crisis, right? We always want to say in a moment of crisis, if there is something acute, a threat, a life threat, we always call 911, right? We have mobile crisis ready and available to help in those situations. If someone is experiencing a crisis or starting to spiral, but not necessarily warranting a 911 response, we absolutely promote the New Mexico Crisis and Access Line as a resource. Now, those aren't always the answers, right? Where it's saying, hey, I need help getting my loved one into peanut butter and jelly so that they can access those ACES supports, right? I think that's more of the question that you're asking here. Right. But I think, again, it's really important to just know, there you go. Thanks, Evan. It's like you're reading my mind there. But I think it's really important to know that Evan, who is also on the line right now, he mans our department phone, and almost on a daily basis, we get 3 to 4 calls saying, hey, I need help. How do I get connected to this service? And so number one, our phone number and website is a resource for everyone, right? We have links and contact information for all of our providers and what they're doing. So if there was a provider that I mentioned that sounds great to you, you can get connected that way by getting their information from our website. Sometimes it's difficult to navigate the website because it's so much information. Even the website is drinking from a fire hose, right? And so we encourage folks to even call our number, and Evan, you can even maybe put that up at some point as well, because that is a venue for which we can help, at bare minimum, connect callers to a case manager who can help connect clients to services. We are actually working on the possibility of developing an app for the Behavioral Health Initiative, and that app can be a venue for which folks can be connected to services a little bit easier, to just say, I need help, and press a button, and it shows you, it can geomap you, right, in your area, what services are available and how folks can get connected. So here's the phone number. Again, it's 468-1555, or our email at bhinitiative@bernco.gov. And poor Evan works 24/7, 365, responding to these calls. And again, part of it is that he helps to connect them to the right folks. I saw that I provided my email address. It's absolutely common for me to get emails or phone calls to say, hey, how do I get my loved one into this? My loved one is inpatient. What do we do afterwards, right? So I field the phone call myself and then connect them to the right folks. And so I think in an effort, while we are building out this app and building out easier venues for connectivity, those are the resources that we have, and I'm happy to field some questions myself as well.
Great. Thank you. And that is very helpful. You know, we're not left open. Adrienne, did some questions get sent in?
Yes, thank you. And this one sort of relates to your first answer was mobile crisis teams. Betty Ann Witten asks, There are only 3 mobile crisis teams now, and training is moving to the city/county. Hopefully this will help us build back up to 6 teams. What information do you have to help us get more teams?
Hi, Betty. Betty's actually on one of our subcommittees. Good to see you. And Betty is actually the president of the NAMI Albuquerque chapter. So thanks, Betty, for joining us. Betty has actually been involved in the development of mobile crisis teams since its inception. So she's a veteran. She's been with us since 2015. But she is right. We've had a number of clinicians leave for other jobs. And I mentioned earlier that we've done a shift in mobile crisis, and this is actually what I was referring to, is that we shifted away from contracting with the provider, and we're bringing those positions in-house so that we can have a better availability and better access to hiring clinicians. So at the last county commission, we approved 4 new crisis clinician positions. Those positions will be posted in the next week so that we can hire more clinicians and backfill those teams. The biggest issue, again, and I communicated this in one of the previous slides, is that we have a very high provider shortage. And so it is very difficult to hire, especially at a master's level, independently licensed clinicians in general. I think the clinicians that we lost under the contract provider all left to another provider who paid a few dollars more, right? So it's kind of this battle in the behavioral health space of like, okay, now Presbyterian is going to pay $3 more, and everybody jumps and goes to Presbyterian, and then you know the group that was missing that gap before, now they added more dollars and people jumped. And so what we are hoping to do by bringing those positions internally is offering the county benefit package, which I think is significant, and being able to pay a higher wage, because a contractor doesn't have, we don't have the overhead costs that a contractor would have. And so we're really excited about bringing those positions internally, as she mentioned, with the city and the county. The county will be hiring 4 positions, and the city will be hiring 4 positions as well. So again, we're really excited about bringing that in. And that was a shift based on information that we received, as opposed to just saying, we'll just kind of keep trying to figure it out through this opposite venue. We didn't want to just wait. We felt like this program is too vital, and we made this shift to bring these internally.
Thank you. Thanks for that answer. There's another question, which some of you may have answered in your presentation, but I think I'll just read it as it was written, coming from a Francesca Bluer. She says, thank you for providing the opportunity to learn more about behavioral health, the behavioral health program. It looks like the response to folks with behavioral health problems has increased. That is great. My concern is if any of the root problems are being addressed: affordable housing for those experiencing homelessness, access to mental health care, etc. And then it's a sort of follow-up question: what is the rate of people chronically in need of these services? And what is the recidivism rate for people returning over and over needing these services?
Those are great questions. Thank you. I think to the first piece, I am a public health professional at heart. And so it's always in my mind that we need to go as far upstream as we can, right? We know in moments of crisis, we have to address a crisis with a Band-Aid, right? We have to address the bleed and get that bleed stopped. But until I figure out where that bleed came from, I'm not going to really impact the larger need. And so we absolutely know that we need to go and address those root causes. This is a good venue. Commissioner, you can chime in here as well. This is a good space to talk about the collaboration between the city, the county, and the University of New Mexico to address things like housing, right? Both the city, the county, and the University of New Mexico sit on the newly developed Homeless Coordinating Council. And that Homeless Coordinating Council's intent is to address the housing needs in the community. The county plays a role in that, right? The county plays a role, as I mentioned, the Behavioral Health Initiative is funding a number of housing initiatives, and Bernalillo County Housing Department funds a significant amount of housing supports in the community. Nonetheless, it's still a huge gap, right? It's still a huge gap. And so you are absolutely right, Francesca. We need to go backwards and work on addressing those needs. Now, COVID has made it even more complicated. Folks who maybe had supports now don't have, and maybe that provider transitioned to all telehealth and they don't have the capacity or the Wi-Fi or the computer to access those telehealth supports. So we've been working really, really hard at addressing access issues prior to COVID, but at an even higher level now that we have COVID. And so absolutely hear that concern and know that that is absolutely on our priority list. Every single project that we fund has performance metrics embedded related to addressing the social determinants of health, right? This is also, again, my public health hat and my own 2 cents on those projects, because I feel that, again, addressing an innate behavioral health need, if we are ever going to get to a space where we want folks to look at behavioral health as equitable and have health parity with physical health, we need to address social determinants of health as well. We can't just address somebody's behavioral health needs without saying, do you have access to healthy food? Do you have access to physical health services? Do you have a primary care provider, right? It's not just we can address your behavioral health need, it's the whole continuum of that individual. And so those social determinants of health are really helping us get at that root cause. I know we're already running short on time, and I can be long-winded, I'm sorry, but it's important to know that we are working with UNM ISR to really assess recidivism rates and ways that we can impact that and the uptake and use of services. I will absolutely say that as of April 3rd, literally April 3rd, the second month of the pandemic, we saw a 3-fold increase in requests for services. And so as the pandemic has progressed, we've seen greater and greater behavioral health needs. And so we're in a funky space right now, right? We're in a funky space. It's not normal data. We can't compare this year to the previous year because of extenuating circumstances, but we are absolutely seeing a significant uptake in services.
I'm going to kind of call us to an end at this point. We're almost at 1 o'clock. I want to say how much I appreciate Commissioner-elect Barboa being here. Margarita, the work of the Behavioral Health Division is, to me, unimaginable. How we can have all of those balls in the air, do it successfully, persistently is a real compliment to the county and to your department and to your work. Thank you to Evan and Brandon for being here and facilitating this whole process. I'm going to end with just a little commercial, which is to pick up on your last theme. I think there are 2 issues for me in the county business, and that is where we see recidivism over and over and over again. We do that through emergency rooms, and we do that through the Metropolitan Detention Center, and we're really clear that we need to do effective programming so that we don't keep having the same people come back with the same problems. And it's not just good for them, it's good for the whole community. And the other piece is the homeless issue. Precariously housed children cannot do well in school. And children who don't do well in school have trouble finding jobs, managing relationships, and moving into the future. And a lot of what we do is to try to develop a system that gets us into a place where people have a home they can count on, have food stability, and can do the kind of work they need, not to require over and over and over again coming into emergency rooms and through our detention center. So it's a huge piece. I guess I would just want to say to District 3, your county is doing a profoundly dedicated job of approaching these. I'm not sure we always do it best. I'm not sure we always do it right, but you can be darn sure that this county cares about these issues and is there consistently. We're at the end of our time. Evan, if you could put that slide back up that has Margarita's phone number and address on it, and tell you that the conversation will continue into the future. Again, Margarita, thank you for coming, and your staff. Commissioner-elect Barboa, we are excited and look forward to your presence among us, and really do believe that the future is a good one for what we're doing, and are delighted to have been able to participate in this town hall. Thank you all very much. Have a good day. Wash your hands. Stay safe.
Mask up.
Yep.